The district leadership of Everytown. In response to the ever-growing concern for the health of school-aged children, district leadership is faced with the decision of determining the effectiveness of the proposed BMI screening program. The costs associated with this screening require consideration when determining if the plan will work and if it's in the best interest of the residents. The policy gives pause when looked at from an educator's perspective. A program like this will take students out of the classroom and away from learning time. It also uses up limited resources allocated to school systems. The implication is not that the policy would be a waste of time, but the current school system is potentially not the best setting to implement it. The high demand for a single nurse in a large school district is difficult to manage without additional policies that increase workload burden. This, coupled with the increasing stress of teacher burnout, puts strain on an already struggling school system. To ask districts to handle the logistics of implementing a policy that would likely result in their teachers filling roles that they are not trained for would be detrimental. Additionally, the students in this decade are at a disadvantage of already trying to reclaim lost time of their education. Pulling students from the classroom to participate in and mitigate BMI screening and related issues is not and should not be the main focus of an educational setting. In order to address the issue of personnel and time away from learning for students, three alternatives to the BMI screening are provided. First, funding for the school sites to maintain a school nurse. This would increase the number of medical professionals on site per district. Ideally, the increase of medical professionals would allow for the health support of students and teachers. Students have some primary care support at their site in their time of need, and teachers are not expected to provide medical care like BMI screening to students. The second policy alternative is to incorporate health education for each age and grade level as appropriate. This will answer a variety of questions that include body mass index, nutrition, genetic factors associated with obesity, and many more health topics. This provides an in-depth educational opportunity to promote health at each level of education without taking students out of their current classes for a one-time event to discuss a potentially foreign health concept. This will give parents a resource to direct to their BMI questions. Finally, the employment of a health educator in each district to be a bridge between public health and school systems. The primary goal of health educator will be to work with families on their health topics like obesity. The health educator will give support to families as a whole to determine health expectations that they have for themselves and aid in goal setting for families to meet their own health. These policy alternatives aim to reduce missed class time and staff burden. It's important to acknowledge that this policy alternative is cost heavy, with the salary and benefits provided to new hires. However, the benefits of these alternatives are much stronger. Funding, parental consent, and buy-in are all interconnected and will be defining factors in the success of these alternatives. The town must invest in long-term holistic wellness of students and their families in addition to BMI screening to raise healthy kids.